Canal 1. Somos contenido.
Welcome to Health and Innovation. Bienvenidos a Health and Innovation. This is a program focused on all the experts and professionals based in health technology management, clinical engineering, biomedical engineering, and health in general. Es un programa dedicado a los profesionales y expertos en ingeniería clínica, ingeniería biomédica y gestión de tecnología, la salud en general. I am very pleased to welcome you to this program today, because we are going to celebrate soon the Clinical Engineering Global Day. So it's a very meaningful program today. Estoy muy contenta de darles la bienvenida hoy porque estamos también a punto de celebrar el Día Global de la Ingeniería Clínica. Entonces, este programa tiene una significación especial. Hoy día vamos a recibir a un colega muy apreciado de Sudán del Sur y vamos a pasar a presentarlo. Today is COVID-19 Challenges and Lessons in South Sudan. I am honored to welcome James LUAL, Program Manager at IFIX Initiative South, Clinical Midwifery-JUBA College of Nursing, and Midwifery Diploma. He's pursuing a bachelor degree in public health at Africa Population Institute of Uganda, and he's a AWEIL youth blood donor, the founder of the club. Also the director of programs of South Sudan Blood Donor Society. Un placer tener entonces a James LUAL, muy emprendedor, pero sobre todo destacado líder en Sudán del Sur. Welcome, James. Set your video on, please.
Yeah, thank you so much. Thank you for welcoming me. I'm glad to be live today. And now I'm going to share a lot of information about South Sudan as well.
Thank you. But please set on your video so we can see you. Okay, thank you very much. Yeah, we can see you now. Thank you very much. So let's go to the first. Again, it's my pleasure. James, it's my pleasure. You are a very good leader, but also hardworking in the health arena. And we are talking now about the relevance of the training in health technology to strengthen the COVID-19 response. Is it important and why? Vamos a hablar del entrenamiento en tecnología en salud como una herramienta para mejorar la respuesta al COVID. ¿Qué nos puedes decir de la importancia del entrenamiento en tecnología en salud, James? Go ahead.
Yes.
Your first topic, please, James. Is it important health technology training?
Yes, thank you so much for welcoming me again. I'm glad to welcome you. I'm sorry again because the network sometimes is not that well stable for us in South Sudan, but I'm glad we are going to connect well. Let's talk.
Mm-hmm. What about the training? Is it important health technology training for the goals in South Sudan regarding COVID-19?
Yes, definitely. Yes, it is actually very important for us. It's very important to have that training.
And how is it going? Do you think it is progress, or do you have some difficulties to train professionals and community there?
Yeah, actually, it's very important because as we speak, we used to train the community, and the community always understand what we are talking about. Sometimes they always understand. Mm-hmm. And actually, it is very important for LS workers to train the community.
I see. Bueno, James, establece la importancia del entrenamiento, de la capacitación en tecnología en salud como una estrategia de respuesta al COVID, y ellos, en particular en Sudán del Sur, trabajan mucho con las familias, a través de las familias, además de los profesionales, para que esta respuesta sea de una manera más sostenida y más efectiva. And what about the community? James, we think about community and also stakeholders, like, for example, the government or the academia. We think about them when we think about building solutions. Share with us something about South Sudan in this regard. Si pensamos en la comunidad y en los stakeholders como la universidad o como el gobierno, para hacer una unión, para hacer soluciones, ¿qué es lo que puedes compartir respecto a esto en Sudán del Sur, James?
Yes, actually, as I told you before, that South Sudan, let's talk briefly about South Sudan. South Sudan is that young nation that just got independent 10 years ago, and followed by the civil war that broke out in 2013. As we speak, the crisis, the LS crisis is not that actually well stable, and South Sudan has been facing a lot of crisis. And then on the issue of outbreak of COVID-19, South Sudan has been facing that, and we actually now training the community on how they should couple on COVID-19. This is how actually we are now training the community, give them awareness on how they should protect themselves about COVID-19.
Sí, ciertamente Sudán del Sur, como comparte James, ha sufrido crisis bastante difíciles antes del COVID, y dentro del COVID-19, pues la respuesta ha sido bastante difícil de articular, y ciertamente el partenariado con los stakeholders y la comunidad ha sido determinante y sigue siendo determinante, como comparte James, principalmente la comunidad. Él le da mucha importancia a la acción y a la intervención de la comunidad en estas articulaciones de soluciones o iniciativas para mitigar el COVID-19. Y si pensáramos en una o dos buenas prácticas que funcionaron en el contexto de COVID-19, James, ¿cuáles pueden ser estas en el caso de Sudán del Sur? What about one or two best practices in South Sudan in COVID-19, James? Would you share with us one or two best practices or lessons? It seems that we have a problem with the internet now, but certainly this is now again. Okay, can you hear me?
Yes, I can hear you. Yes, yeah, okay. I'm back. Yes.
So share with us one or two lessons or best practices in South Sudan regarding COVID-19, James.
Yes, actually, at the moment, the community is already aware. The community is already aware about COVID-19. Now they already aware, and then they are coupled. But we used to teach them about on how the importance of face masks, how they go when they are in the public, they put on the face mask. So it's one of the issues now we used to teach the public, and then we teach them also the boys the social gathering. We used to teach them.
I see. Es interesante cómo la fuerza y la iniciativa de la comunidad, en el caso de Sudán del Sur, es la mejor lección aprendida en el contexto del COVID-19. Una vez que ellos brindaron la capacitación, ellos brindaron la información de lo necesario para responder a la pandemia de una manera masiva, es la comunidad que, ya estando con la información y muy clara de cuáles eran los pasos necesarios a tomar, lograron tomar acciones, articular acciones a nivel de las familias, y esta respuesta se hizo positiva y sostenible. Esta es, de acuerdo a James, la mejor lección aprendida en el COVID-19. Finally, James, I really would like to listen your lessons learned about leadership in health. I know you are developing a very good role in health, mostly in donation of blood. Blood donation is something you are supporting very much, not just in the community, but mainly with young people. So share with us some of these amazing activities you are doing in South Sudan. Ahora vamos a compartir con James parte del extraordinario liderazgo que él está ejerciendo en Sudán del Sur, en principalmente programas de donación de sangre para COVID-19 y en particular en programas dedicados a la juventud. Comparte con nosotros, James, algo de esta parte tan interesante de tu liderazgo. Go ahead.
Yes, yeah, thank you once again. As we speak about blood donation, blood donation actually is the one that we started early in 2018. After we witnessed many people are dying, especially mother and child are dying because of blood. So we came up with this idea to mobilize the community, and then we indicate them. We indicate them about the importance of giving blood voluntarily. So as far we established the Woolies Blood Donor Club early in 2018, and recently we also formed an umbrella, which is national umbrella. We call it South Sudan Blood Donor Society. This society is going to is campaigning nationwide about blood donation, so that the aim, we don't want mother or child to die because of blood. When we understand the blood, there are no manufacturer for blood. It is us, we the youth, to mobilize ourselves and give blood free. So now
Nice.
the youth and the community, we used to indicate them they should give blood voluntarily, so that we have enough blood at the blood bank. This is one of the roles that we are actually indicating public about now.
Excelente, excelente. En Sudán del Sur normalmente, que no es normalmente, pero es lo que ocurría, había un alto índice de muertes de madres y de gente joven, pero también, sobre todo, de mujeres, de madres, por falta de sangre disponible en eventos diferentes, diversos. En el contexto de COVID esto se hizo mucho más agudo y ellos trabajaron muy de la mano nuevamente con la comunidad, con las familias, con los hijos, para sensibilizar a los hijos a través de lo que era y sigue siendo una prioridad, evitar la muerte de mujeres por falta de sangre. Y ahora esto se ha convertido no solamente en una misión compartida por un enorme número de gente que lidera los programas que dirige James, pero también se ha hecho divulgado a otras áreas. Y él está muy orgulloso y, por supuesto, muy contento de que no es solamente su asociación, su programa, sino que han articulado con stakeholders del país para que esto suceda de una manera articulada y también sostenible. I'm very glad and honored, James, to have welcomed you here in the program, to let through your evidences and knowledge and lessons learned, to share with all the people of this program how anyone can go beyond difficulties. How can we keep the mission if we think on health and wellness? Estoy muy contenta y orgullosa de haberte brindado este pequeño espacio en el programa para compartir nuestras lecciones, cómo puede a través de las dificultades, más allá de las dificultades, lograrse objetivos y resultados de salud y de bienestar. Most of all, James, because we are going to celebrate Clinical Engineering Day soon, and certainly clinical engineering has a lot to do with the things and activities you are doing there, supporting logistics, supporting also the strategics and programs through management of technology involved. Estoy muy contenta porque la ingeniería clínica que celebra también su Día Mundial dentro de poco, tiene mucho que ver con lo que estás haciendo para apoyar la logística, para apoyar los programas. Los ingenieros clínicos trabajan en los laboratorios y es muy estimulante saber que estamos unidos en la misma mirada. We are joined, James, in the same view, the same perspective of having our community, our population health, but also with quality of life. Thank you very much.
Thank you so much. Thank you so much. Thank you so much. Actually, I will be glad. I will be glad to join even the conference and we'll talk more about South Sudan.
Es una gran alegría conocer un poco, solo un poco, de lo mucho que Sudán del Sur tiene para mostrarnos. It's a very nice moment for everybody to know just a bit of a lot of things that South Sudan has to share with us in this regard of the COVID-19. Thank you very much, James. Y a ustedes, amigos, un gran saludo. Vamos a celebrar nuevamente muy pronto el Día de la Ingeniería Clínica. Esta es una manera sencilla pero significativa de saber que estamos en la mirada de desarrollar soluciones para COVID-19. Estamos muy contentos de tenerlos a todos ustedes y los esperamos muy pronto. Gracias. Thank you very much. Clinical Engineering is going to celebrate his Global Day, and we are very proud, James LUAL, ROSSANA, RIVAS, to join this celebration as well. Thank you.
Canal 1. Somos contenido.